Morning and welcome to everyone to this important conversation. I am Nancy Chen, a member of the Executive Council of AARP Illinois. Thank you so much for attending this event today with a very important conversation on no data, no justice, a discussion on the lack of data on the Asian American older adult experience. And once again, I just want to mention that this event is being recorded as required by Illinois law. Many of you know me through my involvement with the Asian American community, now almost over 30 years. And so it is great to see so many of you here today. As you know, just like you, I have been involved with a lot of Asian American issues. And I started with the Disrupt Disparities project from the very beginning. And like so many other Asian American issues that you have experienced, that the lack of data has really bothered me, and especially on this project on older Asian American adults across our very diverse community. So this is why that we bring together our community leaders like yourself. Each has a unique experience, perspective from your community so that we can discuss the experience of Asian American older and Pacific Islanders, the adults in Illinois, and how the lack of data and evidence is having a very negative impact on our communities and also on our elders. And then, of course, the important thing is how we can address this data challenge. And at this point, I'd like to turn this over to someone you all know, Andy Kane, Executive Director of Asian American Advancing Justice, to walk you through our program for today.
Thanks, Nancy. So we have brought together a great set of panelists for today's discussion. But before we get to the panelists and that discussion, Mary Anderson, Director of Advocacy and Outreach and Chicago Director of AARP Illinois, will walk us all through the Disrupt Disparities research and report with also a short video. And the report focused on the racial disparities of older adults in Illinois. We'll then turn our panel to our experts to discuss the data challenges that really have faced the API community and talk a little bit more about that. And then we'll also have a facilitated discussion with all of you so that we can learn from each other and hopefully we can identify better ways to address these data challenges. And on a personal note, for me, it's really fitting that we're having this conversation today. Today marks the 5-year anniversary of the passing of my mother. And, having taken care of both my parents, this work has been deeply fulfilling on a personal level. And so I'm very grateful to be here with all of you. And I really look forward to this conversation. So with that, I'd like to turn it over to Mary to present the findings of the Disrupt Disparities report.
Thank you so much, Andy. I really appreciate it. So soon up on your screen, you'll see our presentation of our Illinois Disrupt Disparities initiative. So I'm just going to wait a moment so that can come up on your screen. And there we go. Here it comes. And so while we're waiting for that to come up, let me just give you a little background on this initiative. So the Disrupt Disparities initiative is an initiative that was brought together by 4 organizations: AARP Illinois, Asian Americans Advancing Justice, Chicago Urban League, as well as the Resurrection Project. And what this project is an opportunity for these 4 organizations to come together on the issue of racial equity focused on older adults. We worked with Loyola University of Chicago and their Center for Urban Research and Learning. And what Loyola did is they looked at over 125 different studies, reports, white papers, great papers, and other sources to bring data together, and also worked with AARP research to look at American Community Surveys data. And what we did with that data is we looked at the broad areas of economic security, health, and connectivity. And we look at those areas in order to kind of determine where are the racial disparities that we're seeing amongst older adults. So let me just talk to you a little bit, actually, oh, look, there it is. So why don't we go to the slide with the video, and we'll tell you our story. And that's okay, Al. We'll just move on. So let me tell you some of the results of this report. So on economic security, what we found is that the median income of whites who are 50 years and older is 1/3 more than African Americans, Latinos, as well as Asian American Pacific Islanders. We also learned that African American older adults are more than 3 times as likely to live in poverty than their white counterparts. Latino 1.7 times, and then Asian American Pacific Islanders are 1.2 times more likely to live in poverty than their white counterparts. And here's the data that was really important to us. If you can go back one, Al, is if you look at home ownership, almost half of African Americans, Latinos, and Asian American Pacific Islander homeowners over the age of 80 still have mortgages on their homes, which is twice as high as their white counterparts. And why this is so important is, as we know, the strongest tool to close the racial wealth gap is home ownership. And if we have older adults over 80 still holding mortgages, that makes them very financially unstable, particularly at a time like COVID right now, where we're feeling extra economic pressures. Go to the next slide. In healthcare, what we found is that healthcare providers and pharmacies, we're seeing basically healthcare deserts, because we're seeing these providers and pharmacies being concentrated in white neighborhoods across the state. And this is particularly important during this time of COVID when we're looking at vaccines, because this is really hurting older adults of color being able to get access to vaccines. Then we looked at healthcare coverage, and we looked at healthcare coverage of 50 to 64, and then 65 and older. And when we looked at 50 to 64, we did see higher rates of lack of healthcare coverage for older adults of color. And as you'll see, older Asian American Pacific Islanders between the ages of 50 and 64, 11.5% did not have access to healthcare coverage. But then here's the point that's very concerning to us. If you look at those older adults, 65 and older, Latino older adults are 18 times more likely not to have healthcare coverage. Asian American Pacific Islander older adults 65 and older are 13 times more likely not to have healthcare coverage. That means Medicare, the biggest tool in order to get healthcare coverage for older adults, is not reaching a significant portion of older Asian American Pacific Islanders. And next slide, please. We also wanted to look at the COVID-19 pandemic that was happening right now. And so, as you know, 96% of COVID-19 deaths in Illinois are for folks who are 50 years and older. And of those deaths, 3.79% of those deaths are older Asian American Pacific Islander. But here's the thing, we are also finding significant undercounting of Asian American Pacific Islanders in the COVID-19 data. When you look at the data for both death rates as well as positivity rates, the other category is larger than the Asian American Pacific Islander category. And as we talk to our colleagues in the field, we think that that is a sign of significant undercounting of how the COVID-19 pandemic is affecting older Asian American Pacific Islanders. Next slide. And so we did a separate white paper in this report, really focusing on the lack of Asian American Pacific Islander data. So in Illinois, over 670,000 folks in Illinois are Asian American Pacific Islander, with over 186,000 of those folks over the age of 50. This is the fastest growing population in the state, which is why it's so important for us to be gathering data. 8 out of 10 older Asian American Pacific Islander residents in Illinois speak a language other than English in the home. And while it was very difficult for us to find any disaggregated data, the disaggregated data we could find in Chicago showed us that 1 in 5 Chinese American older adults live in poverty, and 1 in 4 Korean American older adults live in poverty. So what we really found is there's a true lack of data being collected on the Asian American Pacific Islander experience. And then the data that is being collected is not being disaggregated. And what's the result of this? Well, that's one of the things we're going to talk about today. But we definitely know one of those results is that that means that there's a lack of resources getting to Asian American Pacific Islander older adults. As we know, data connects to resources, and we're concerned that this is affecting our local communities. So as you know, the purpose of data is to make systemic change, which means we want to get this data so we can actually do this work. So I'm going to turn this back over to Andy now so we can start our important discussion.
Thanks, Mary. So, as you all just heard and saw, the research did find significant gaping holes in the data collection, both by government agencies and others on the experiences and needs and challenges of the API community. Many times there's no data at all, right? That is collected from or clearly designated as API individuals or communities. And even when that data is collected, as Mary mentioned, it rarely is disaggregated into specific communities so we can have a clearer picture of what is actually happening, right, for specific communities. I'd like to introduce our speakers for today's panel, and they're going to discuss these data challenges and the effects that they have on our specific communities. As I mentioned, we are going to have a facilitated conversation where you're going to be invited to participate at the back half of that. But first, I'd like to introduce our panelists. And the first one is Diane Williams of Loyola University Chicago Center for Urban Research and Learning. Diane was one of the lead researchers. We spent a lot of time with her on Zoom over the last few months for the Disrupt Disparities report. Diane is currently a graduate student completing her PhD in social work at Loyola. Her research is focused on social welfare policy, housing for older adults, and intersectionality between race and aging. Diane has a master's degree from both Columbia University and the University of Chicago Harris School. So thank you, Diane, welcome. Daphne Kwok is the Vice President of Multicultural Marketing at AARP with a focus on the API audiences. In her position at AARP, Daphne is focused on creating national and regional partnerships with organizations to lift the voices and needs of the API older adults. Now, Daphne, as many of you know, has served under President Obama's Commission on Asian Americans and Pacific Islanders and was chair of that commission for 4 years. Next, we have Angela Houghton, is a senior research advisor for multicultural research for AARP. And in her role, Angela has provided research consultation, data analysis, and insights on multicultural and diverse populations in support of AARP's mission to empower people to choose how they live as they age. And then finally, last but not least, is June Lim, Demographic Research Program Director for Asian Americans Advancing Justice LA. Great to have a California presence here from our affiliates. June leads Advancing Justice data research work in California and across the country, including our work on the 2020 census, working to ensure that there was an adequate count of the API community. With that, Mary, I hand over this really fantastic panel of experts to you.
Thank you so much, Andy. I'm really excited about this conversation we're about to have. So I just want to look, before we begin, I just want to let folks know, if you have questions throughout the event, please feel free to put them in the chat, and we'll be collecting those questions and having the panelists answer those questions near the end of the event. And then we're also going to be doing some interactive survey questions throughout as well, so please feel free to answer those as those come up on your screen. So Diane, I'm going to start with you, since you were the lead on this great work that we were doing. When you were conducting this research for the Disrupt Disparities report, and you were reviewing all the dozens of studies that you were looking at, what were your findings in regards to Asian American Pacific Islander data, or the lack thereof?
Okay. Thank you, Marion. Thank you, Andy. And thank you to Nancy and the entire AARP team for spearheading this charge with Asian Americans Advancing Justice, Chicago Urban League, and the Resurrection Project. When our team at Loyola University Center for Urban Research and Learning was conducting this research, we had two main goals: to find out and analyze what do we know so far, and to determine what are the challenges before us, right? So first, what have we found out? Some of this is going to echo and to reiterate the presentation that Mary just made, and also to highlight the tremendous need of research and additional research and the challenges that are before us. So when we're looking at issues such as poverty, Asian American Pacific Islanders 50 and over are 20% more likely to live in poverty than white counterparts. Now, the median personal income, it's relatively high compared to African American, Black, and Hispanic Latino counterparts, right? So it's a little bit over $30,000 compared to white counterparts earning a little over $40,000. But what is interesting is that it's not the entire picture. When we take a closer look, that median income represents predominantly those who are 50 to 64, okay? People who are predominantly working. Now, what is truly shocking is how quickly and rapidly this median income declines for Asian American Pacific Islander individuals. When we look at the demographic of 65 to 79, the Asian American Pacific Islander median personal income falls just under $15,000. What would be the EITC eligibility requirement if the age gap were to be removed? What is even more startling is past the age of 80, Asian American Pacific Islanders emerge as the racial demographic with the least median personal income, with less than $10,000, less than $10,000, and that is the median income. But that's just one aspect. Another aspect of economic stability is, to Mary's point, housing ownership. When we look at the data about housing ownership, about 67% of the Asian American Pacific Islander community, 50 and over in Illinois, own their homes. It's comparable to white counterparts. Now, what is less highlighted and less known are the devastating financial burdens that come later in life. For white homeowners 80 and over, about 19% still hold a mortgage. However, for Asian American Pacific Islander homeowners 80 and over, almost half still hold a mortgage. That's the most of any racial demographic. Okay. So this is all within the context of the immediate concerns of evictions, increasing property taxes, and it's all within this backdrop of rapidly declining income, older age, and continued mortgage payments. Okay. But this economic gap is not the only disparity we found. Our data shows gaps in accessing healthcare. Between the ages of 50 to 64, those Asian American Pacific Islanders who are covered under Medicaid make up over 20% of all those who are served, making the Asian American Pacific Islander demographic the second highest racial category. Not to mention, the Asian American Pacific Islander community is in desperate need of coverage. The Asian American Pacific Islander community is 13 times more likely than white counterparts to be uninsured. And while coverage is part of the picture, another part is language accessibility and cultural competency. In Chicago, there are over 70,000 older adults who have limited English proficiency, which is comprised of about 35% of the total LEP population. 8 out of every 10 AAPI older adult speaks a language other than English at home. Okay. This really begs the question of how can we help to promote health equity models in our state and communities? Broadband access and telemedicine may be a key. Our research shows the Asian American Pacific Islander community experiences the highest level of broadband connectivity. Now, this could be a golden opportunity within the context of bridging language and cultural barriers and access to trusted medical community professionals via telemedicine. So this brings us to what are the challenges before us? Collectively, we know we must work together to advocate for change. However, our diverse communities within the AAPI moniker needs better individual representation. Asian American Center for Advancing Justice conducted a report which takes a closer look at ethnic needs within our communities. So, for example, when we're talking about poverty, okay, we tend to think of the Asian American Pacific Islander trend when it comes to income and employment, okay, and how it fares better than other racial groups. This does not reflect the disparate needs of those in the community. 1 in 5 Chinese American older adult and 1 in 4 Korean American older adult in Chicago live in poverty. And when we're talking about poverty, 20% of Pakistani Americans live in poverty. So we have a diverse portfolio of ethnicities, and we need to have representation. And this is just one of many examples which we aim to capture, which representatively reflects the struggles of our communities. Okay, we need to equip our leaders, policymakers, and funders with the information tools which are reflective of the nuance and the very real everyday struggles of the people we aim to serve. Ultimately, we need to ask ourselves, how can we invest in advocacy and research which is representative of the tremendous needs of our respective communities? Thank you, Mary. I'll turn it back to you.
Diana, thank you for that, especially raising up those specific issues. And I love the golden opportunity on telehealth and connectivity. I think that's fantastic. So I would love the opportunity to hear from the audience. So we're going to give our first poll right now, and you'll soon see coming up on your screen a poll. And we're going to ask you, so how has the lack of Asian American Pacific Islander data affected you as a community leader? And you can check as many of those as you want. So just take a moment right now and answer that, and then click at the bottom and we'll give the results. So yeah, has it been that your organization has not been able to gain government or philanthropic resources? Or, oh my goodness, I'm seeing the results already. Can I call these out already? This is looking pretty intense. We're getting some good answers here right now. Also on policy arguments, we're also looking at media attention. And then also we do not face the challenges because of lack of data. And so far, I'm not seeing that answer coming up at all. So I'm going to wait a moment to make sure everyone gets a chance to answer. All right, so I'm going to end this poll right now. Let's see what we got. So you see at the top one, organization not able to get government or philanthropic resources. 71% of you said that, yep, that is definitely one of the results of not having data. And second, looks like it's not being able to make the policy arguments or be as effective on policy advocacy. Thank you so much. This is great. All right, so we're now going to go to our next speaker. And our next speaker is Daphne Kwok. So Daphne, I want to ask you, so based on your really vast experience in working on these issues, because of this lack of that data regarding Asian American Pacific Islander communities and individuals, what are the effects on Asian American Pacific Islander communities, especially older adults?
I just want to say Gong Xi Fa Cai, Happy New Year to everybody. And it's so great to see a lot of great friends who are here. I'm so excited about the opportunity for AARP to get more engaged with the Chicago, Illinois AAPI community. And we're so fortunate that Nancy Chen has continued to serve as an executive council member. And she talked about being in community for several decades. And I have to say, I was with Nancy, from several decades ago. And so it's so great to be able to continue to work with her. And I know that all of the groups that are here on the call right now, thank you for all that you have done for the community, especially when it comes to, I know you were involved with census, you were involved with census data, voter engagement, and all of the issues, and really being on the ground to serve our community. With AAJC, they have always been the go-to place for data over all these decades, right? You guys really were one of the first in our community to be serving our community, to really emphasize the need for data collection. I have to say it's a bit ironic because for people that know me, math and science were definitely not in my academic wheelhouse at all. So that's why in college I avoided all of those. But getting into the community and getting involved in the community, I have to say in the early years, we did not talk about data. But it's so exciting to see that over the last, I would say at least 10 years now, in every meeting we go to, right? Every conference we go to, the AAPI community now is talking about the importance of data disaggregation. And so that we are starting to make differences. And I'm so pleased that actually with the President's Commission, I was able to serve with several of your leaders coming from Chicago, that literally every meeting we went into it didn't matter what agency, federal agency, there are always two topics we address. It was the need for data disaggregation, as well as language access. Those were the two issues that didn't matter what agency, whether it was a Coast Guard or whether it was a CIA or whatever it was, those were the issues that we brought up. So it's so great to see that at least it is now in the lexicon of our community, and that data advocacy is one that is being brought about. I also have to really commend Mary as well as Angela Houghton. Angela is here in DC with the research team, and since I've been at AARP, first of all, it's so great to be in an organization that has research department, right? But Angela really truly has been a tremendous advocate. She truly understands. And for the last, 8 years, every time Angela knows Daphne's going to ask about the AAPI community and what about the data, what about the data aggregation. So we've been working together to try to move this issue forward, not only for AARP, but also for the field as well when it comes to methodology. And so Angela really has been a tremendous advocate for us. I think one of the things that, Diane certainly brought up tremendous disparity data right there for us. I think it's even more pronounced right now, right, as a result of COVID. And I happened to, in preparation for this meeting, I just went on trying to Google, okay, what comes up when we talk about COVID and communities of color, right? And we know that absolutely for the African-American Hispanic, being hit extremely hard, but rarely, is AAPI even brought up in those articles within those data sets. And yet we know that for some of our communities, especially the NHPI communities, being extremely hit hard right now. And so we have to constantly be the advocate to constantly raise, but yes, COVID also impacts our community. The need for the vaccine as well too, right? We need to continuously inform and educate our community about the importance of the vaccine, or is it good, is it bad, to dispel the misinformation in our community as well too. So I think that all of these are examples. I think that, as many of you know, Helen Zia, she often talks about in her speeches, MIA, AAPI's MIA, missing in American history. I would also say AAPIs are MID, right? Missing in data as well too. And I think that we continue to all be advocates and continue to work to make sure that we collect data, whether it's quantitative or qualitative. I think one of the things that we as a community constantly talk about, the qualitative is just as important as the quantitative as well too, because that story gets told in that qualitative. I would also say that I would also raise too, that while we have, and I know all of you here on this call are advocates for the importance of data and data disaggregation, I think it was really very, very disturbing in the last few years too, of those people within our community who are debunking the importance of data disaggregation, especially in higher education access. As we all know, the Harvard lawsuit, right? Affirmative action, and how, because it may be a small group, but their voices are getting heard, of that group saying, oh, we don't want data disaggregation. It is hurting AAPIs. And I think as a community, we also have to figure out how to inform and educate that group that they are destroying the work, Nancy's work over the last several decades, right? All that we have been building slowly to get to data disaggregation. And we have a small vocal group getting attention that is really tearing down our work. So I think also as we try to advance data disaggregation, how do we get to those segments of our population that don't understand? Personally, I believe they're actually being very selfish. If you want to put it out there, they're being very selfish and thinking only of themselves and not for the greater good. So those are just a few tidbits, but I look forward to listening and hearing from all of you as well. So thank you, Mary, for including me. Oh, can I just say one more thing?
Please do.
One more thing. I just want to say that when I first got to AARP about 8 years ago and realized there's a research department, one of the first things I did with the research department is I asked them, what AAPI data do we have and what can be made public? And I asked that we release as much as possible. So in those early years, we came out with 3 research reports. One was on the economic security or insecurity of AAPIs 50 plus. One was about healthcare, a lack of healthcare access for 50 plus. And one was around caregiving, which is a major issue for AARP and the work we're doing with the AAPI community. So I felt it was very important that AARP push out whatever data we have that is public. So we continue to do that to really help you with your policy, with your grant writing, so that hopefully we can help all of you get more money to serve our communities. Thank you.
Oh, Daphne, thank you so much. And the true importance of advocating for the data and advocating for the use of the data. And I just want to remind folks, please feel free to put questions into the chat, and we'll be getting those questions to the panelists shortly. And in the meantime, we're going to have another survey for all of you, the audience. So we're going to put another survey question up here, another poll for us to answer, so we can get your input as well about the importance of this issue. So hopefully it'll come up shortly. And the question we're going to be asking you is, what would having access to Asian American Pacific Islander data allow you to do as a community leader and allow your organization to do? Would it, so feel free to answer this. And once again, you can choose as many as apply. Would it help you apply for government grants or contracts? Would it help you apply for philanthropic support? Would it help you build political power? Would it help you build coalitions and organizations? So please feel free to fill that out. I got a few more people who need to vote, and once that voting is done, we'll share those results. Yeah, so what would having access to Asian American Pacific Islander data allow you to do as a community leader? All right, we're just going to give it a few more seconds. And let's look at these results. So 89% of you said you could apply for government grants and contracts. 89% you said it'll help you get philanthropic support, but I'm also seeing also building political power and also building those coalitions with other organizations. So yes, so data is power, as we know. Great, this is super. All right, so I'd like to go to our next set of panelists. So actually, we're going to try to do 2 at the same time. So we have 2 major research experts here on the call, Angela Houghton and June Lim, and who've been doing this work for many years. And so really would like to get your thoughts on like next steps. How do we address this challenge? So, you know, what do you see as potential options to address these data challenges? And in a perfect world, what would be happening in order to collect this data?
So I'll jump in. Hi, this is Angela Houghton with AARP Research. Thank you, Mary. Thanks everyone for inviting me to be part of this conversation. Thanks, Daphne. Daphne is just such a fabulous partner, and I love working with her. I have a few things to offer on this question, and I definitely want to leave enough time to hear from June too. But I think, you know, part of what the community, the Asian American community groups have really been leading the charge on this for so long. And I think, you know, now I'm so glad to see all the people here that are interested in hearing about this issue and understanding the impact and why we need to continue to find more solutions. And I think one thing that we can do is just continue to raise awareness about why it's needed. And I also think that, you know, I'm so glad that Daphne mentioned qualitative data, because we all know that we want the quantitative statistics, that's the important thing that's needed to really sort of make the political case, and also to get the dollars and the resources. But I think it's important to remember that behind those numbers are people, and that's what we get with the qualitative data. We stay connected to the humanity of this. And Andy, it was so awesome that you offered with a story about your mom in the beginning, and I appreciated that so much, because I think that is helpful for us to remember, like, who is at the center of this and why we're doing it, and who is not getting their stories told or heard. And anything that we can do to raise the value and the importance and the use of qualitative data is helpful. And I think the demand for this. So if we can bring awareness outside of just within the Asian American community groups who know why and need this data first and foremost, but if we can broaden the understanding and awareness of this issue beyond just the community groups to all users of public data sets, to anyone who's trying to understand what's happening with people in America, if it's in, you know, public health spaces. Right now, there's so much work on equity. Daphne mentioned the COVID-19 data and statistics, and there's a lot of interest and effort on equitable distribution of the vaccine. But if we don't have the data, we really can't understand it. So I think it is of the interest of everyone to realize what is lacking and then sort of get on board with finding solutions. I think one thing that this past year proved, with us being able to have a vaccine available, is that when everyone agrees that something is important and a priority, we can all together find solutions. So I just think the more that people have an understanding of the importance, not just of collecting the data, but also the disaggregation of it. And one thing that we're starting to do within the research community, and actually, I think Pew has started to do this in some of their releases, is to, in anything that's publicly released, to have some sort of transparency statement. So any user or consumer of data is saying, you know, either we were not able to, you know, report AAPI data, or we have AAPI data, but it's not complete, or it was only collected in English, or it doesn't, some sort of educating statement that at least is putting out in front of data users and consumers where the data is limited now. So I think, you know, there has been a lot of, the research field has sort of moved for a lot to online research, and for all of the reasons that Diane enumerated about the older adult AAPI community, you can understand how that's not going to be a great methodology for reaching a lot of older Asian American and Pacific Islander adults. For the language access reasons, while you might have broadband access, so people are online, but if you're only inviting them to be part of your research in English, or if there is a literacy barrier there, you know, you're not going to capture them, or they won't be part of a research panel because perhaps there's a cultural barrier to understanding the public value of participating in a survey or doing research. So all of those things are additional barriers. And I think, you know, as online panels and that data that's sourced from online panels is a way that a lot of experiential and survey data is used. So we have all of this sort of government data that's collected, which is really helpful. And I think Asian Americans Advancing Justice has done so much great work with disaggregating and analyzing that data. And then on the other side, we have our survey data, where we ask people for their opinions, their needs, their experiences, their beliefs, and we want to understand really what's going on inside the hearts and minds of people. And those things are where I think we get a really skewed perspective of what's happening with the Asian American community if we're only if the primary source is coming from online panels that are really underrepresenting or misrepresenting the community at large. So that's another area where I think there's been some interest and some work to try to build that capacity within the field and to do some special and targeted recruiting and building up of that ability to reach more and diverse segments of the population in some of our research tools. And there's another resource that has been, I've talked to several of you on this group call now, but at UCSF, they've been building up a registry of older Asian American adults that would be available for research around health issues as you age, dementia and family caregiving experiences. And so that's a great, those kinds of solutions will be great for us to continue to build that up and to expand it more broadly and to raise awareness of the need for it so that we can sort of pump up the demand. As we're building up the capacity, we also want to increase the demand for more and more people to want to use those resources.
Angela, that's wonderful. June, I'm dying to hear from you too, because I know you've been doing some really fantastic work in this area.
Great, thank you, Angela, for setting the tone to the responses to the question that was asked, and thank you everybody for having me join today. I'm joining from California, so what I really, Angela and Daphne all touched upon a lot of the things that I had been thinking about in preparation for this panel, and I really wanted to just emphasize some of the points that were raised because I think that they're really important. I've been asked like in the past month or so to speak a lot about data disaggregation. And so I think this really shows just the interest that there is, a growing interest in this and how data is really a necessary part of, achieving like racial justice and equity in our community. It's like a necessary part so that we could tell our stories. And I think Diane really provided excellent examples from this report about how the Asian American and Pacific Islander community is not a monolith, and really to shatter the model minority myth. When we're aggregated, I don't need to tell you all this, but I'm gonna, just emphasize this anyways, that when we are clumped all together in an aggregation, it really does not tell the stories, the diverse stories in the ways and the paths in which we have arrived in the US. It really ignores the different relationships that countries have had with the US that actually brought us here. Because, some of us came here by way of immigration, others came here as refugee resettlement. And when we are all aggregated, we really lose the importance of that history and the stories in which we arrived here. So some of the things that I think about when I think about data disaggregation is that first, the stories, right? The ability for one to be able to, even when taking a survey, to self-identify and to be able to either select a category for which they identify with, or to be able to write that in, is very empowering. So I think that's some of the, you all did work with the census, and there were only a few categories that you could select for Asian or Pacific Islander, but really the encouragement and empowering of our community members to make sure that they complete the right and answer so that they can be represented in the data. And that is like one opportunity for people to be able to say, look, I'm here, and this is how I identify. The other part is the language access piece. We really can't emphasize that enough, because as the data shows, some of the data shows that there is like huge differences in the percentage of limited English proficient individuals we have across our Asian community. I ran some data last night quickly for Illinois. So just to provide some examples is like in Illinois, based on the 2010 decennial census, Vietnamese Americans have like 60% LEP, so speak English less than very well, whereas Hmong Americans is at 23%. So the range is very wide. And when we don't have this information, we don't know. When we don't have this information, we don't know which languages we need to cover and at what percentage. Of course, this doesn't even capture our communities that are smaller, and that's another thing that that is really important, is that we have larger communities that might have more presence in terms of showing up in the data when it is disaggregated. But how do we ensure that the needs of our communities that are in smaller diffusion are represented as well? In terms of solutions or potential opportunities, Angela really talked about this, is that you all are really the experts of your community. You have the pulse of, you know the pulse of the community and the needs before they even show up in the data at this time. So it's really like, how do you continue the amazing work that you do in pushing this issue, and make the stories that you know about your communities heard? Angela really emphasized the importance of qualitative data, and how do we take those stories and kind of form a critical mass in terms of stories about experiences or stories about certain communities that are not known. And so like those are kind of the things, like you really are the people who are able to help to push the envelope forward. And you know the stories. It's just, how do we capture it, and then how do we put it in a format in which that it can be heard? So one way we do it is these reports that we've put out before. We've worked with AARP on certain reports focusing on older adults, and there's regional reports that we have produced as well. We're actually moving these reports to a digital platform that we're hoping to make data more accessible and available to partners such as you, as well as the larger community, but also so that in creating policy, people can look at the data and to the extent that it can be disaggregated. We don't know what the census data is going to look like this time around, because there's a lot of additional layers in terms of privacy protections, but to the best that we can, we are going to try to make that data available on a digital website, as well as looking for the qualitative stories to help to enhance that data. Let's see, I think I took some other notes. Oh, in terms of opportunities, I know for the polls that there was also talk about like, how do you build power? Right now, we're working on redistricting here in California, and that's kind of a way where we're not only using it as an opportunity to collect the stories of our communities so that we can gather information to understand like where our communities of interests within our ethnic communities, or however a community might define themselves, and really as a way to ensure that that where we can build power, or where we can ensure that communities are not split up by districts, like that's one way to build like local power, in terms of making sure that communities that tend to bind together on certain issues are not divided, right? And then that's how we start to create the opportunities to elect officials who are going to be listening to the needs of the community. So that's just what came to mind, like as something that's occurring at this moment in time. So that's something to just consider. It's a way to get your communities involved, to really help to build power within themselves and empower them to be able to tell their stories and to advocate for their local communities. And then the other part was, you know, when I think about COVID, we can't not talk about this, is is I was thinking about even here in California, how we're doing vaccine outreach, education. The language access part is huge. I have been able to sign up my parents for the vaccine, but they wouldn't have been able to do it themselves. It's only in English. In terms of the website, you have to click on like, I don't know, 10 different websites, because you have to click on the city website, the county website, the state website, the pharmacies, and individually, and hope that you get lucky with winning the lottery. And it was like my brother and myself both on our computers, like trying to get this information and trying to get them signed up. So, you know, like if that's the case, and we are able to do that, but we know that not everybody can. So there really is an issue with equity and justice when it comes to being able to access this vaccine and just care. So I think I went on for a while. I think these are the notes that I've covered so far. But I'd love to hear from you and just, you know, have conversation with you today about these issues. So thank you.
Oh, June, this is really exciting. And I have to say, I'm, as you were bringing up the COVID, I'm thinking about the challenges we're having here in Illinois with our government entities on language and access. And we're really pushing the need to bring the vaccine to people instead of forcing people to go through these systems that are not culturally competent, not language competent to bring them to. That's such an incredibly good point. So I want to get a chance to get some of these questions to the panelists. There's some incredibly rich questions here in the chat that we're going to be getting to all of them, or hope to get to all of them. I do want you to know we're going to be keeping these questions. So if we do not get to all of these, we're going to see if we can get a chance to get this information out, because these were really fantastic questions. So we do with this first one, and this is kind of actually for everyone on the panel. We've had a group of questions about strategies to increase research participation among Asian American Pacific Islander community members. You know, and Angela, you mentioned a lot about trust. So for the group, what do you think would be some effective strategies to build trust in participation? And is there something you've seen work well so far in building trust? And any one of you can take that.
Well, I asked a question. The reason is being that, you know, as a immigrant Chinese community, I completely get it, because we have so many, such a loud voice on WeChat, right, about data, So I felt like it isn't just about politics; it's really about education. But before you educate someone, you really need to have that kind of relationship, and then much better like a one-on-one, I mean in person. So we're just struggling how it's almost like it's really hard, because there's people have a lot of internal conflict from the communist China, and a lot of issues, and you know, I'm one of those, and a lot of issues they never know how to deal with their own conflict and trauma, or you know, whatever. So in a sense, I think that psychologically, mentally, they need to be able to learn how to deal with their own emotional frustration, whatever, right? So that is, I felt that is a big hurdle. That is why, you know, how can you build that trust? Meaning that you really get to understand the rationale behind it, not just because right or left. It is a lot more complex than that. And then once we, you know, take care of that issue, then you can really have a civil dialogue. So I don't believe like a labeling, like either size, because, you know, I'm a nurse educator. So I always use that principle about empathy and understanding where people are coming from and start from meet where they are. So, but I don't know, I don't have an answer.
So Angela or June or even Daphne, in your experience, you know, how do we build that cultural trust in this research?
I think maybe I'll take a stab at that. I think, you know, one of the questions in chats that's going on is, the education of why it's so important. Why is participating in this research so important? And I think that, how can we have some kind of educational messaging campaign that going out into community where we sort of lightly, softly introduce the issue, the topic in some broader, top event, whether it's Lunar New Year or May APA Heritage Month, or what other channel can we start to address and really use examples. I think the best thing is how can we use examples of how AAPI data has really benefited our community very specifically, and being able to show, well, this result happened because we had X number of AAPIs participating in the research and data. So I think I may be thinking also, how can we inform and educate around the importance of participating?
Yeah, I'll add to that. I think that's a great suggestion. I think one thing that might have helped us with the Census 2020 efforts, which was really, there were so many people out trying to get the word out to the community about why it was important to participate in the census, and by extension, there's sort of educating about the importance of public data. And I think your point about an example, Daphne, is really good. And one thing that I heard in terms of one very specific tactic that I heard some researchers say was effective for them is, well, first of all, this all takes, as someone mentioned in the chat, it takes time. It takes the patience. It takes the investment in relationship building. It's not just, hey, trust us because we said so, and I think to Lily's point too, it's like understanding where the distrust comes from, addressing that, and just really showing a commitment and taking the time to build the relationship. But one thing that was useful that someone shared in another panel discussion was an explanation that, hey, if your community doesn't participate in this survey, then the opinions and the experiences of other people will be standing in for you. So without, what is the sort of opportunity cost of not having the data? And maybe that's a way that can help people see. So with the data, here's what good can come of it. But without the data, there will be a real misunderstanding about what's happening in your community, because people will fill in the blanks with other data or other, impressions that they have that might be wrong. So that could be another way that's effective.
I think actually one of the things that we're fortunate is in the AAPI community is that we do have researchers, right? Whatever the topic might be. And I think one of the things maybe what we ought to do as a community is really shine the spotlight on our researchers and the research that they're doing to show how they are contributing, right, to whether it's COVID, vaccine, or whatever the issue might be. But maybe we need to take our researchers out and shine the spotlight, and hopefully they will become interested in talking about their work, why it's so important. And as we know, academics, researchers, those within our community are very highly respected as well too. So maybe that's one way is to utilize them as spokespeople and advocates, and hopefully the trusted messenger as well too.
Yeah, I was going to bring up trusted messengers, but I think that together would work well. And maybe providing some examples, piggybacking on what Angela said is, maybe we have some examples of data of a particular community, and maybe it's not particular to that geography because we don't have it, but it can be used as an example to say, hey, look, we were able to tell the story in this place and be able to push for resources here. This is an opportunity for us to be able to start to do that more locally. Or on the flip side, this is the story that we have about Asian Americans. Does this tell your story? If not, then how do we tell your story? So I think that's really, through the Census 2020 efforts, what we really learned and can't emphasize enough really is the power of trusted messengers in our community. And I think the local community matters a lot. So really working together in tandem with the trusted messengers like yourself, in trying to build that trust with the community members is critical.
I would like to chime in for a moment. I think that I completely agree with Angela, June, and Daphne, and echo their stance for advocating for a trusted messenger within this process of data collection, and being able to not only communicate the importance of the data, but also the potential opportunity cost that comes with the lack of data. This issue of finding trust in the relationship, especially when you have cultural and language barriers. These are just some examples of the intangible barriers that are before us when we're talking about the Asian American Pacific Islander communities and the vast and diverse ethnic portfolio that's within us.
Thank you. We got a lot more questions here in the chat, so I want to make sure we get to some more. So actually, Diane, this is for you. How many Asian American Pacific Islander ethnic groups were you really able to get meaningful data about in the work for Disrupt Disparities? Were there any ethnic groups that you had a particularly large void of data about?
So what is really highlighted through our research is the lack of ethnic breakdown within this database. So when we're talking about generalizable massive collection of information, we have this issue of grouping and this lack of disaggregation of data, and the cost and of this disaggregated data. It's twofold. While it provides us with the kind of political push and advocacy power that we need, it also does a disservice because it cloaks the disparate needs of those within the community.
And we also actually, along those same lines, we have several questions in the chat about resources needed to build and fund the infrastructure for collecting this research. Can any of you on the panel talk more about what is needed to ramp up these data collection efforts?
Okay,
Oh, go ahead, Angela.
Okay, I'll start and then you come in. Yeah, I mean, this is a big question. This is a big challenge, and I think it's going to take a lot of people working together and pooling resources to bring it to fruition. I think money is big. It's very expensive, as we all know, and so it's an obvious answer. But I think if we could find ways, I mean, the thing is that the need is shared across so many sectors and so many people that's why I feel like there should be a way forward in bringing people together, pooling resources, and all agreeing to work together to build this capacity and this resource and this infrastructure. And so the more people who view it as that they have a stake in it for their own work, then I think that would be a path to success. June, I don't know what you think.
I think that sounds great. I was also going to say that I think coming from like a program or social services perspective, also to think about the data that you already are collecting, that there likely is already data but people don't think of it as data. And that is also a way to start building information about your clients or your local community and their needs, and there's information there that can be used, so maybe, and then that could be built at a higher level as well as you collaborate with other partners, but to not underestimate the information that you already do have about your communities, and how do we translate that into information that into something that can be used in a narrative and a proposal, or when speaking with a local official. It's just something that came to mind is that you have a lot of that information. We just need to get it down and put it in a way that can be presented at a higher level. So
Actually, June, as you say that, there are several organizations on this call who are doing just that, who are collecting their own data, creating their own systems in order to do that. I know one of the questions in the chat actually had to do with that about, where should they go? Like where's their whether it's funders or organizations that have access to these tools that that local community organizations could be using to actually build data.
I think, for Asian,
Salesforce.
for like Asian Americans Advancing Justice Los Angeles, we are a census CIC. And so a part of what we do is to provide some of that technical capacity support. So I'm happy to support any organizations or individuals who are interested in having a conversation as to how do we start to think about this. And I think also just even thinking about not like how, I'm trying to like think this through as I speak. How do we try to build a system that you don't have to add too much extra work on staff that are already are burdened with their own programs and services? So really trying to figure out, be it a system of documentation or something that can easily feed into something to begin to collect that information. I know a lot of organizations want to really understand how to collect data at the forefront of everyone who comes through the door, and how to make that like possible to do it organization wide. So be happy to think that through, but I think that's it's just a process that requires so many different players within an organization to even begin to build that. But something that I'm happy to have conversation with you all as to like what data might already be available, and what data you might already have, to just really start to think about that.
If I may, just to continue off of what June is saying, this collection effort of a standardized subject area or standardized topic areas for data collection. I think that it extends, or it could extend beyond an organization in and of itself, that if we can pull together our collective organizational thought leaders and collectively come up with universal data collection points and start from there. What it could do is to harness the power of the Asian American Pacific Islander category, or the moniker. And within that, continue on to, in addition to, also collect ethnic demographic information for our local constituents who desperately need representation.
So I'm thinking about there's a lot of political power on this call today. I mean, we have all the top leaders of Asian American Pacific Islander organizations in the state of Illinois. So where should we be focusing this kind of the push to get the change on this? Should we be focusing on philanthropic organizations? So should we be pushing the large foundations, the Rockefellers, the Fords, the MacArthurs? Or should we be putting this focus on government entities? So we be pushing the state of Illinois and how they're collecting their data, and the federal government, our local government entities? Or should it be a kind of a combination? Like where should we be putting our emphasis for our advocacy to make change on this data issue?
Yes, 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 and yes.
Well, Mary, as you know, we have someone we're all very familiar with who is running the Illinois Department of Human Services, who is Asian American, and used to run one of our community organizations back in the day. Seeing some of the faces on the Zoom, but we have a budget situation, to put it mildly, here in Illinois. So, I don't know what limitations that might impose, but I'm going to defer to the rest of the organizations that I know have had those conversations with philanthropy about data collection. So I'd love to hear what they have to share.
Hey, Andy, thanks for that comment. I'll just jump in there. Just speaking on behalf of Castle, we made 3 years ago, we made a 6-figure financial commitment for our build out of our sales platform from bottom up, from scratch up. That took us like a year and a half to build out. Just to tell the group, I'm committed to $1 million plus to build our data platform, and we raise our own dollars every penny to do that. I approached the philanthropy group, really saying what all of us are saying on this call, is that there is not enough data. How can we have a voice for our community if we don't have enough data? And how can we pivot and be very nimble, such as this pandemic right here, to help our community if we do not have the platform to help our community? So I'll share this, our six-figure commitment, and we put in another 6-figure commitment. We wrapped artificial intelligence, Einstein analytics with it now. Castle is now big data. It's gotten to the point where Northwestern University is now working with us and other universities around the country. And it's well worth it. It was a massive 3-year, and so I'm building another 3-year out for this process. But I will say this, that when I approached the foundations and the private philanthropy groups, there's a lot of hesitation because it's one, many API organizations are not really in the data collection and technology space. So I think it's really important for us to garner collective voice so that we can approach philanthropy as a group versus just a castle versus CMAA. Dennis Mondero and I speak about this too, and a few others. Two, I think it's really about the organization's leadership and making this commitment. I tell many leaders, API leaders around the country, when I speak in New York, Seattle, Houston, I say that philanthropy in the next 10 to 15 years, wealth of this generation that we see now, that are the retired, the baby boomers, are going to transition to what we consider the younger generation, the millennials, and they see data very differently. And so they're never going to give to an organization that the parents and grandparents give. They want to see impact. And typically, this newer generation, they want to see data that is live and instant. So they want to see that. If not, there's already research showing the younger generation gives very differently. And so I've been in contact with MacArthur, McCormick. I just presented to the Ford Foundation in Philadelphia, and so on. And we speak actually at Salesforce every year at the conference about this and trying to drive that need for data within our community, not just nonprofits, but specifically for the API community. And before we go into talk more about data, I think we need to have a strategy for us to come together as API community and say, what's our need? Right? When I speak to the leaders, again, it's like they're searching themselves. Like, our staff doesn't know about data. We have to educate our board. We have to educate our community, buy into it. And they're afraid about putting out a 6-figure investment, right? And they're putting their necks out because of the budget is very slim. It's very small. It's a nonprofit. We hold our money very tight because much of our money goes into programming. But I think we need to sit down and have the dialogue of why it's important for data and show the leaders why. And that's what I'm hearing. It scares me. It really does. When many leaders say, I don't need to do that. I say, well, how are you going to survive the next 10, 15 years? You're going to be left behind, right? The second thing is that it's not just the initial cost of the technology platform, right, to build out. All that nuts and bolts and logistics you can get the consultants to do. It's about continued education to the staff. It's really about the financial means to educate all of the staff and entire organization to buy into it. And when it comes down to it, from our experience here, you need money. You know, we had to build out a Center for Social Impact, you know, with 4 full-time team members, a manager, a data-driven person, a data policy person. We had to do surveys that connects to the community, and that's really hard. But you need money and to make sure that happens. The staff is simply not going to be able, or nor have what Dennis actually said, the human capital to do all the data collection. They're running around dealing with the pandemic. They're running around the program. They got to hit their deliverables and so on and so on. And finally, for us, we had to take a strategic move. We actually stepped back for a year, and I actually said to my team, why are we doing things that we are doing that we don't need to do? And so we started doing things that we don't really need to do. And so that it allowed my team to have more time, resources to pivot, to focus on the technology. And we're just really on the second phase of Castle build out. It's the first phase, the second phase, but it's just not the API organization. You know, we speak at the for the YMCA, we presented to Action for Children in Illinois, and so on and so on. We're hearing the same thing. You know, it's like when I put in my chest, those 5 concerns, they're all in the same space right now. And many leaders I speak to are very concerned about this transition of wealth. 60 to 65% of wealth will be transitioned to the next generation in 10 years. And how are they going to be ready for that? And many of them concerned to be left behind. So I mean, that's our experience, and you know, we do our best to talk about it, and we're not perfect. You know, but I do know one thing: once we invested into our Center for Social Impact team, all our team members made that financial commitment for all of them Salesforce certified. Because to hire a Salesforce person out in the for-profit market is $150,000 minimum. But we have our staff, we made the professional investment to get them trained, and all of them are Salesforce certified. We actually cut our technology costs down of build out. They're actually building it out for us in-house now. So we're seeing tremendous ROI in the process of doing this now. So the bill is sometimes 75 to 100, 150,000. Our staff said, no, we can do it. And we just need to put this patch in. It's only $5,000 for organization. So we're saving a tremendous amount of money when we going through the process.
So it sounds like a lot of upfront investment and into the infrastructure and the training to build that. And then how do we share that across the community? I'm realizing as we're having this conversation, the one entity that we haven't talked about is academic institutions. Like, what are the roles do you think of academic institutions in addressing this challenge? And are there, like for example, Paul, you mentioned Northwestern, are there academic institutions, particularly in Illinois, that we think would be good partners in this fight? And Diane, I realize you do represent Loyola.
What if we approach University of Chicago? They have the business school where it's, I believe it's a program for social impact. And we can work with the graduate students, and I believe they have year-long projects. They can help us build that process out. And typically, I believe it's pro bono services for the nonprofits.
Hi, I agree with Paul. So thank you so much for this lead in, Mary and Paul, and just a little plug for Loyola University Chicago here. I would like to say that it's a great opportunity for academics to get involved with research and community-based research, and having not only students come and be part of the community and fully understand what the data is trying to reflect, but have the data also tell the stories and be representative of the people. And I think that when is often the critique between academics and practice is this gap. Is the gap of, you know, is what are the numbers really capturing the stories of the people you're trying to serve? And I think that it would be immensely beneficial.
And I would like to share that actually we're right in the middle of a couple projects. I think the growing area for us is to realize being both academic, because I'm teaching in nursing school, as well as a community organizer. So I have a little bit of both worlds. So what I find is that how do you really foster that shared decision making? And that's a huge step, I think, with the community participatory research. Obviously, each organization or institute have their own interests, which is completely normal, right? And then how do you really build in that process and also the mechanism and also time and patience to really have a very strong foundation to build the trust first again. And so that I think it takes a village. We absolutely need to have academic resources, you know, from the technical to the expertise area. But ultimately, I think the intention, the purpose of the research is the most important. Who are you going to try to serve? And who will benefit from this kind of research? So that need to like really communicate it very well from the very beginning. And what we experience is that it is all like a normal growing process, growing pains sort of, but it does take time and takes a lot of leadership as well to recognize the differences and have to really kind of reflect, why are we here? What problem we're trying to solve? Who are we going to try to benefit? Especially from the community members' perspective, for your publication and for your tenure or for your whatever, if they have that sense, and that's not going to be working very well, you know? So I was recently at a community forum with Duke, because I'm now in North Carolina. There's a tremendous distrust. Yeah, there was a tremendous distrust between the Duke and the Durham community. I never knew that before. So it was kind of sad, but anyway, it was not a secret, obviously. But anyway, I think because of that trust not there, I think it's really important to have a shared decision-making at the highest level of community participation.
Thank you, Lily. I'm hearing themes throughout today about trust, building community connections, access to resources. I'm definitely hearing that as well. And I'm identifying multiple next steps that our collaboration can be taking in order to address this issue. And so I'm really excited about those next steps. Unfortunately, we are running out of time, but I do want to let you know that we are going to be keeping what's been happening in chat, because there's also an incredible conversation happening in chat amongst all of you as well, and we'll be sharing that. But I would like to turn it over to Nancy Chen, and thank you all once again for participating in this really important discussion today. Oh, Nancy, you're on mute.
Thank you so much for all the panelists and the participants for such an engaging and lively conversation. I learned so much. And so first, Diane, thank you for paving the way, giving us the background. And you know, when you hear the statistic, you really know that the urgency of having enough data. And Angela, I'm so glad that you're at AARP and doing the research on me. But I really want to give a shout out to Stephanie. I mean, first Stephanie identified, we've been there, you know, for some time now. She's much younger than me. But this is the leadership, and I'm so glad that you are there at AARP giving a very important voice for AAPIs. And your continued advocacy champion for all of us. Really appreciate that, definitely. And Mary, you know, I mean, this project could not have been started without Mary's championing and dedication. So I really want to give her the big shout out. And of course, we have June here, and thank you for coming all the way from Los Angeles to join us. I just want to give a few seconds about what I heard. The trust issue, and I know that we are talking about trust among our community members. And I want to use an example of what AARP is doing right now, is that this is your step of building trust with our community. Because, you know, often organizations, political leaders pay lip service, and they only come, I mean, I'm talking about political leaders, they would only come during the election time, but they're not in your community, they don't talk to people. But over the years, I learned building trust is really a time-honored thing. You have to be there all the time. You can't just say, jump in, do this, and give up. And so I really believe that this is the first step, also in a broader sense for AARP, to build trust with our organization. You know, this is a very meaningful conversation. And I know it's the first step of many, and I hope that's the way. And the other thing about the data that June talked about, this is something I struggle with. In the meantime, that we want to build this coalition with the AAPI, but in the other sense, we are talking about disaggregation data. So how can we balance that we maintain that coalition for political and for even deep data research, any kind of empowerment, we need a big group. But then how are we going to do it when we start talking about disaggregation? So that was actually a really good conversation that we have. And I would urge, and I've come from more of the public service political side, is that when we talk about data collection, resources, I would say it's really government as well as some philanthropic leaders. Government, all of you need to talk more about the lack of data, not just among ourselves. Really go out to say we cannot function, we cannot really do the service our community without talk to our Asian congressional caucuses about that. They have the power to do something at the highest level. You know, talk to our Illinois legislators. You know, we have 3 or 4 actually Asian legislators, and they do something. So really, it's among all ourselves that we have to not just talk within ourselves, talk outside, and perhaps that way that people also see the data. You could do your work to build trust with your constituents, but we have to also build the needs, you know, outside our community. So this is what I kind of took away from our conversation. But I wanted to make sure that if you're more interested, this is the very first virtual conference that we have for the Disrupt Disparities, all the events. And there was more. If you're interested in, go to www.aarp.org/Illinois to find a full calendar of events through April. And the other thing I like to invite you is to register for a Disrupt Disparities Summit that AARP is doing with the Illinois Department of Aging, and that is going to take place on April 26th and 27th. And we hope that you will join us, and also giving voice, you know, at a bigger forum for the Asian American and Pacific Islander community. So I thank you again for joining us, and it's great to see all of you, and you've done a marvelous job. Thank you.